we're talking about how ART would specifically be beneficial to tennis elbow. So first we ought to understand what's going on with tennis elbow. Generally, tennis elbow is a tear. It's a tear of usually the tendon or the muscle-tendon junction as it attaches into the lateral elbow. Of course, it can happen on the medial side as well, or even to the tricep tendon. Usually we're talking about this guy right here. So if we zoom up here on the arm, and let me get you to wiggle your fingers, you can see the course of the anatomy. The muscles continue down the arm all the way in to the fingers. Really give me some motion there, and you can see those guys. Go ahead and relax. The problem with tennis elbow is not just the tearing here. The problem actually goes back a little further than that. It usually occurs in the muscle first. Through years of wear and tear, the muscles can develop fibrous adhesion, micro-tearing that leads to scar tissue. The net result is a muscle that should be elastic, like a rubber band, ends up becoming tough and leathery. So imagine this: if you have a piece of leather, or sorry, we'll start with a piece of rubber going from here to here. Every time you strike the ball, there's going to be a nice elastic give at the attachment point here. Rather, if you had tissue that became more leathery, and you had a piece of leather strapped from here to here, every time you strike the ball, you're going to get a more sudden tugging. So the classic example, I mean, it's kind of easy to visualize. If we just take a belt, you've got sudden tugging versus an elastic giving, and that's how we end up with tennis elbow in many cases. So what ART can do is we can go in, break up the scar tissue, and restore more elasticity to tissue that's become leathery. When we restore elasticity, we get rid of the tugging at the end point, and it allows the tearing at the muscle-tendon junction to begin to heal. We can demonstrate how that's done. Classic way ART is going to work is by stripping and tearing scar tissue away rather than trying to compress it. Traditional deep tissue massage is going to go in and try to compress the tissue, and that's about like trying to remove bubble gum by smashing it. Rather, we can take that scar tissue, which has a bubblegum-like quality, and break it up by applying tension. What we're going to do is get the muscle moving one way and the scar tissue moving the other. So I'm going to have you flex the wrist and flex the fingers while I trap the scar tissue. And you go ahead and do that. We apply some tension up opposite the direction of the muscle movement, and we can get scar tissue to break loose. So this was a classic active release pass on the common extensor muscle. We apply the same principle to the extensor carpi radialis longus and brevis, brachioradialis, the extensor carpi ulnaris, and we have a supinator muscle underneath that that also often gets involved. We can even have adhesions that extend all the way down into the palmar fascia that will end up binding the normal motion and putting more tension on the muscle-tendon junction. So what we're going to do is treat the whole kinetic chain, restore elasticity, and thereby minimize tension to the injury site, allowing it to heal better.